I'm Patricia Stuart. I'm a GP and I've been involved with training GPs for quite some time. We're really wanting to look more and more at vertical integration. And vertical integration is where there are different levels of learners all teaching each other. With the increasing numbers of doctors, particularly those that we're going to be sending rurally, there is an enormous need to share the load of teaching and learning to avoid burnout in the supervisors. With the increasing numbers of doctors, more junior doctors and interns are being sent on intern placements into the community. That means that rural GPs, rural hospital doctors, are now being expected to train more in terms of numbers as well as in terms of breadth and depth of what they're doing. And there is an enormous risk of burnout among these supervisors. So the model is being introduced that when we send registrars to a centre, that they'll be involved in training the junior doctors, they'll be involved in training the medical students. And medicine's a continual evolution of training anyway. It's a lifelong learning. So the supervisors will learn from the registrars will learn from them, and it's a shared model of teaching. With the community placements, we also have to recognise that the practice managers have an enormous amount to share. When doctors graduate from medical school, they have very little financial knowledge. So they don't know how to manage a practice. And one of the huge areas for learning is around Medicare, around finance, around practice management. And the managers can also be involved in training. And within the community practices, we mustn't forget the nurses as well, because the practice nurses have an incredible breadth and depth of knowledge in things like immunisation, in sterilisation, in chronic disease management, and they need to share with the junior doctors and the medical students as well. So that again can take the pressure from the supervisors. Also in rural areas, we are needing to involve the allied health, the community pharmacy, the ambulance, the paramedics, all in this horizontal, multi-professional and vertical integration. So it's not just a static model of learning, it's one that's spread across a whole range of health providers. And in doing this, it means that the junior doctors understand the roles of the other health professionals as well. That leads to better team care and ultimately to better outcomes for the patients. They learn to understand each other's roles, they learn to work with each other, and all of that leads to a much better outcome for the patients. The model of registrars teaching junior doctors, teaching medical students, is also founded in educational principles and adult learning principles, because it's been demonstrated that teaching, peer teaching, and teaching anyone really, leads to deeper learning and to learning that is retained rather than superficial learning that's just forgotten. So educationally, it's a really good model. It's a really good model for the community, and it's a really good model for the patients. So I think we need to be exploring vertical, horizontal and multi-professional learning much more for our rural communities.